KReBS, Knee Replacement Bandage Study, Application Guide for Coban 2 Compression Bandage System. Equipment required include the comfort layer, which is marked number 1, and the compression layer marked number 2, as well as micropore tape and scissors. Following application of an adhesive dressing over the surgical site, the non-sterile Coban 2 in a comfort layer marked number 1 can be applied. This can be started with or without the tourniquet being inflated, and the foot should be in a slightly dorsiflex position to aid articulation following application. Start at the foot just above the toe line and wrap proximally. The foam layer, which is white, is positioned against the skin. Avoid wrapping the plantar aspect of the heel, as this reduces bulk and allows normal footwear to be worn. This layer should be put on with minimal tension and approximately 10 to 20% overlap, which enables minimal bulk. This layer often looks untidy. When you reach the mid-thigh level, trim the remaining bandage and secure the flap with tape. Next, apply the Coban 2 compression layer, which is marked with the number 2. Start at the foot, at the metatarsal heads, and ensure that there is a small amount of the comfort layer left free distally. Be wary not to apply the compression bandage in the locked out state, as this can cause excessive compression and tightness for the patient. Instead, stretch from the resting state approximately halfway and wrap the leg accordingly. Now, wrap the foot including the heel area. To prevent dog ears and flaps, utilize a further throwback around the foot before working proximally up the leg. Ensure that the compression layer is stretched and applied with approximately 50% overlap. This allows the bandage to compress, and if you miss a bit, simply re-wrap and double over. Continue wrapping the leg proximally, maintaining the correct tension and the leg in an extended position throughout. Wrap the rest of the leg, leaving a small amount of comfort layer uncovered around the thigh. Trim the remaining bandage using scissors. Finally, pat down and smooth the compression layer onto the leg to ensure good adhesion to layer 1. The aim is to keep the bandage in situ for up to 48 hours. It must be removed prior to discharge, and the time of removal should be noted in the medical or nursing notes. If removed before 24 hours, the reason why must also be stated. Thank you for your participation in KReBS.